Top 3 vitamins every diabetic should take. Lower blood sugar. Living with diabetes after 50 can feel like walking a tightrope every single day. One meal, one misstep, and blood sugar can suddenly rise without warning. Fatigue, nerve pain, and constant worrying slowly take away the joy of simple moments. But what if small, powerful nutrients could quietly support your body from within? What if the right vitamins could help stabilize your blood sugar, protect your nerves, and bring back a sense of control? This is not about complicated diets or expensive treatments. It's about giving your body exactly what it needs so you can feel stronger, calmer, and more in charge again. Before we begin, take a moment to care for your future self. Subscribe to the channel and join a community focused on healthy aging and diabetes care. Like this video and share your thoughts in the comments because your journey can inspire and help someone else feel less alone. Vitamin D plays a critical role in helping the body use insulin more effectively, which is essential for maintaining stable blood sugar levels in people over 50 living with diabetes. When insulin works properly, glucose can move from the bloodstream into the cells, where it is used for energy. Without enough vitamin D, this process becomes less efficient, leading to higher blood sugar levels and increased strain on the body over time. Some research suggests that low levels of vitamin D are linked with greater insulin resistance, a condition where the body does not respond well to insulin. This can make diabetes harder to control, especially in older adults whose metabolism naturally slows down. Doctors often highlight that improving vitamin D levels may support better glucose control. Although it should be seen as part of a broader care plan, vitamin D also helps reduce inflammation, which is commonly elevated in individuals with diabetes. Chronic inflammation can damage blood vessels and contribute to complications such as heart disease and nerve problems. By supporting a more balanced immune response, vitamin D may help protect the body from these long-term effects. Some doctors warn that ignoring inflammation can silently worsen diabetic conditions over the years. Bone health becomes another important concern after the age of 50. And this is where vitamin D plays a vital role. It helps the body absorb calcium more effectively, which keeps bones strong and reduces the risk of fractures. People with diabetes may already face a higher risk of falls and injuries, making this benefit especially important. Weak bones combined with unstable blood sugar can create serious health challenges if not properly managed. Another key function of vitamin D is its role in supporting the pancreas, the organ responsible for producing insulin. Proper pancreatic function is essential for maintaining steady blood sugar levels. When vitamin D levels are adequate, the pancreas may work more efficiently, helping the body respond better to changes in glucose. This support becomes even more valuable with age. As natural bodily functions gradually decline, vitamin D also contributes to overall muscle strength, which is important for maintaining balance and preventing falls. Strong muscles support daily movement and independence, something many older adults value deeply. Some studies suggest that adequate vitamin D levels are linked with improved physical performance, which can indirectly support better diabetes management by encouraging regular activity, despite its importance. Vitamin D deficiency remains very common, particularly in older adults who spend less time in sunlight. The body's ability to produce vitamin D from sun exposure decreases with age, making it harder to maintain healthy levels naturally. This is why some doctors recommend testing vitamin D levels and considering supplements when necessary. Always under proper guidance, maintaining balanced vitamin D levels is not about quick fixes, but about steady support for the body. When levels are too low, blood sugar control can become more difficult, and the risk of complications may increase. Over time, this can affect energy, mobility, and overall well-being. By ensuring adequate intake, the body receives the support it needs to function more efficiently. Some healthcare professionals emphasize that vitamin D should be taken in appropriate amounts, as excessive intake may lead to unwanted effects. Balance remains essential, and regular monitoring can help maintain safe levels. Combining proper vitamin D levels with consistent diabetes care may support better long-term outcomes. In many cases, improving vitamin D status has been associated with modest improvements in blood sugar markers, according to some clinical observations. While it is not a replacement for prescribed treatment, it remains a valuable supportive nutrient. Paying attention to this simple factor can make a meaningful difference in how the body manages glucose each day. Over time, Maintaining healthy levels may help create a more stable internal environment, allowing the body to respond more effectively to insulin and reduce sudden fluctuations in blood sugar levels naturally and safely. Vitamin B12 plays a vital role in protecting the nerves, which is especially important for people over 50 living with diabetes. Nerve damage, often referred to as diabetic neuropathy, is a common complication that can lead to tingling, numbness, burning sensations, or even pain in the hands and feet. Vitamin B12 supports the health of nerve cells by helping maintain the protective covering around them, allowing signals to travel properly throughout the body. When levels are low, this protective layer can weaken, increasing the risk of nerve-related symptoms that affect comfort and mobility. Some doctors warn that vitamin B12 deficiency can quietly develop over time, especially in individuals who have been managing diabetes for many years. This is particularly concerning because the symptoms of deficiency, such as numbness or tingling, can easily be mistaken for diabetic neuropathy itself. As a result, the underlying cause may go unnoticed, allowing nerve damage to progress further without proper support. Vitamin B12 is also essential for maintaining healthy energy levels. It helps the body produce red blood cells, which carry oxygen to tissues and organs. When vitamin B12 levels drop, the body may struggle to produce enough healthy red blood cells, leading to fatigue, weakness, and a general lack of energy. For older adults managing diabetes, this added exhaustion can make daily tasks feel more difficult and reduce overall quality of life. In addition to physical energy, vitamin B12 plays a key role in supporting brain health. As the body ages, cognitive function can naturally decline, leading to memory issues, slower thinking, or difficulty concentrating. Adequate levels of vitamin B12 help support normal brain function by contributing to the production of important chemicals involved in mood and memory. Some research suggests that low levels of this vitamin may be linked to increased risk of cognitive decline in older adults. Another important concern is that vitamin B12 deficiency is quite common, particularly among individuals taking certain diabetes medications. Some widely used medications have been shown in studies to reduce the body's ability to absorb vitamin B12 from food. Over time, this can lead to a gradual depletion of B12 levels without clear warning signs. Because of this, some doctors recommend regular monitoring of vitamin B12 levels in people who are on long-term diabetes treatment. Vitamin B12 also supports the proper functioning of the nervous system beyond just preventing nerve damage. It helps regulate the communication between the brain and the rest of the body, ensuring that movements remain coordinated and responses remain sharp. This becomes increasingly important with age, as maintaining balance and coordination can help reduce the risk of falls and injuries. In some cases, individuals with low vitamin B12 levels may also experience mood changes, including feelings of irritability or low mood. This happens because vitamin B12 is involved in the production of neurotransmitters that influence emotional well-being. Maintaining healthy levels may help support a more stable and balanced mood, which is an important part of overall health in later years. Some studies have shown that correcting vitamin B12 deficiency can lead to improvements in nerve function and a reduction in symptoms such as tingling and numbness. While it may not completely reverse advanced nerve damage, early support can make a meaningful difference in slowing progression and improving comfort. This highlights the importance of identifying and addressing low levels before symptoms become severe. Healthcare professionals often emphasize that vitamin B12 should be maintained at adequate levels through proper diet or supplementation when needed. Since the body's ability to absorb this vitamin decreases with age, even individuals who eat well may still develop a deficiency. Regular checkups and simple blood tests can help ensure that levels remain within a healthy range. Maintaining sufficient vitamin B12 is not just about preventing deficiency, but about supporting the body's ability to function smoothly and comfortably. For people over 50 living with diabetes, it offers protection for the nerves, supports energy production, and helps maintain mental clarity. Over time, this steady support can contribute to a better quality of life and greater independence in daily activities. Magnesium plays a direct and essential role in improving insulin sensitivity, which helps the body use insulin more effectively and maintain stable blood sugar levels. When insulin sensitivity is strong, glucose can move more easily from the bloodstream into the cells, where it is used for energy. In people over 50 living with diabetes, this process often becomes less efficient over time. Low magnesium levels can make this problem worse, leading to higher and more unpredictable blood sugar readings throughout the day. Some research suggests that magnesium deficiency is closely linked with increased insulin resistance, a condition that makes diabetes harder to manage. When the body does not respond properly to insulin, glucose builds up in the blood instead of being used by the cells. This can lead to fatigue, increased thirst, and long-term complications if not addressed. Doctors often note that maintaining adequate magnesium levels may support better glucose control, especially in older adults. Magnesium also plays an important role in regulating how insulin is released from the pancreas. A balanced release of insulin helps prevent sudden spikes and drops in blood sugar levels. For seniors, this stability can reduce feelings of dizziness, weakness, and discomfort that often come with fluctuating glucose levels. Some doctors warn that frequent blood sugar swings can place extra stress on the body and increase the risk of complications over time. Heart health is another critical area where magnesium provides support. People with diabetes are at a higher risk of developing heart-related conditions, including high blood pressure and irregular heart rhythms. Magnesium helps relax blood vessels, allowing blood to flow more smoothly and reducing strain on the heart. It also supports a steady heartbeat, which is essential for overall cardiovascular health. Maintaining proper magnesium levels may contribute to better heart function and reduced risk of complications. Muscle function is also closely connected to magnesium levels. Many older adults experience muscle cramps, tightness, or weakness, especially during rest or sleep. Magnesium helps muscles relax and contract properly, reducing discomfort and improving overall mobility. This becomes especially important for seniors who want to maintain independence and continue daily activities without unnecessary pain or stiffness, in addition to physical benefits. Magnesium has a calming effect on the nervous system. Living with diabetes can sometimes bring stress, worry, or mental fatigue. Magnesium helps regulate stress responses in the body by supporting the production of calming neurotransmitters. Some studies suggest that adequate magnesium levels may help reduce feelings of anxiety and promote better sleep, both of which are important for maintaining balanced blood sugar levels. Low magnesium levels are very common in people with diabetes, and this often goes unnoticed. Increased urination, which is a common symptom of diabetes, can lead to the loss of magnesium through the urine. Over time, this can create a cycle where low magnesium worsens blood sugar control, and poor blood sugar control further reduces magnesium levels. Some doctors recommend checking magnesium levels regularly, especially for individuals who have difficulty managing their diabetes. Certain signs may indicate low magnesium, including muscle cramps, fatigue, weakness, or irregular heartbeat. However, these symptoms can be subtle and easily overlooked, which is why monitoring levels through proper testing can be helpful. Addressing a deficiency early may help prevent more serious issues from developing later. Magnesium also supports the body's natural ability to produce energy. It plays a role in converting food into usable energy, which helps reduce feelings of tiredness and supports daily activity. For older adults managing diabetes, maintaining steady energy levels can make a meaningful difference in overall well-being and comfort. Maintaining adequate magnesium levels is not about quick results, but about steady and reliable support for the body. By improving insulin sensitivity, stabilizing blood sugar, supporting the heart, relaxing muscles, and calming the mind, magnesium offers multiple benefits that work together over time. For people over 50 living with diabetes, ensuring sufficient magnesium intake can be an important step toward better balance, improved comfort, and stronger overall health. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.